Alright, we got a patient here.
What do we have here?
She's stable and lucid. She's 27 years old, female, and she's involved in a motor vehicle accident. And she's pregnant, so we're going to check for internal injuries right away.
Let's have her admitted for further evaluation.
Yep.
Everything will be fine. The doctor will be here soon.
Hello, Mrs. Berry?
Yes.
Hi, I'm Dr. Young, and I'm the attending emergency physician for today. I'm going to be looking after you. I'm just going to ask you a couple questions. Could you tell me your full name and your date of birth?
Anna Berry, and date of birth November 21st, 1983.
Okay. Okay, so is there any specific area that you're having any of your pain?
Up here.
Up there? Okay, I'm just going to palpate around and you tell me if you feel any pressure, okay? Anything there?
Yeah.
There? Okay. So there appears to be some sort of injury, although it's not obvious to us, but first we're going to run a routine ultrasound examination just to make sure that the baby's okay and stable, all right? So a nurse will be in to take you down for your ultrasound, okay?
Okay.
All right, I'll be back afterward.
I hope the baby's going to be okay.
Don't worry, it'll be fine.
Hey, Mrs. Berry, I just looked at your ultrasound and your baby appears to be just fine for right now.
Oh, thank goodness.
So we're just going to run a couple more diagnostic tests just to make sure you don't have any more extreme internal injuries that we're not aware of, okay?
Okay.
Okay, so the porter's going to take you down to the department now, okay?
Don't worry, you'll be fine. The baby will be fine.
Hello, Mrs. Berry. So we have the results of your test, and it looks to be a little bit beginning of some serious internal bleeding. We are going to need to perform emergency surgery to try to correct the problem.
Is surgery the only option? I just want the baby to be okay.
At this point, we can't control the amount of bleeding, and prolonging this any longer is going to make it worse for you and the baby, and it can ultimately cost both of you your lives. Now, we're going to get you ready for surgery right now, but rest assured I'll give you a couple minutes with your husband. I also need to know if you wish to give your husband consent in the chance that you are not able, of a sound mind, to make a correct decision.
Yes, of course. I trust him.
Okay, I will get the nurse in to get you prepped, and I'll be back in a couple minutes. I'm going to give your husband this form to fill out for you because you're in no condition, so just talk to him and answer the questions on the sheet, okay?
Okay.
Thank you.
Hello, Mr. and Mrs. Berry. You've had time to talk and fill out the form?
Yes, I did.
Okay, I'm just going to take that back from you. I'm going to take a quick look at it. Okay, so we're almost ready to go, Ms. Berry. I just have to verify one thing. It says here on the form that you've never had a blood transfusion before. In surgical procedures, a blood transfusion is sometimes necessary if there's a substantial loss of blood. If it arises that you do need one, do we have permission to perform it?
No, absolutely not.
Is there a specific reason why? Can I ask that? I can assure you that in surgery, this is a routine procedure and it poses both minimal risks to you and the baby.
It's against my religion. I'm a Jehovah's Witness. I've been following my religion faithfully for many years now, and I'm just not about to go against it now.
Okay, I'll consider that and I'll document it on your form. However, may I say from my medical opinion, I encourage you to have this procedure done as it can make the difference between life and death. There's also the fact that you're responsible for the life of not just you, but for that poor little baby there. We need to commence with the surgery as soon as possible, but I'm going to give you a few minutes to say goodbye to your husband before you go into surgery, okay?
Okay.
I understand this is hard for you, but this could cause us to lose our child.
You understand that I don't want to have a blood transfusion under any circumstances. It goes against everything I believe in. I just can't. It's not an option.
I know it's against your belief, but think about the child, not just about you.
I know you don't believe in what I believe in. Okay, I understand, you know, you don't follow my religion, but I can't.
Okay, well, you got to think about one thing. You got to think about both of your health and the baby's health.
Hi, Miss Berry. It's time for your surgery. Are you ready?
Yeah.
Okay, I'm just gonna take you to a room now, okay?
Okay, don't worry, I'll be here. I'll see you when you get back out, okay?
Alright, I'm just gonna move the bed. Mr. Barry?
Yes.
Hi, so your wife is stable right now, but there seems to be a little loss of blood. So if her condition worsens, we might need a blood transfusion.
Thank you for keeping me posted. I hope we don't need that because she's really against that. She doesn't want that, and I just want the best for her and the baby.
Alright, and the doctor's doing all he can, so we'll keep you posted.
Okay, thank you.
Oh my goodness, Robert, I got here as fast as I could. How's my little girl doing?
She's doing well. She's fine. She's in surgery. She was involved in a car accident, but her and the baby is fine.
Well, the baby, how's the baby doing?
Well, right now they're both doing well, but she has lost some blood, and she didn't want to have a blood transfusion, but they told me that they might have to have a blood transfusion because of the amount of blood that she has lost. She really didn't want that. Before she went in, she was really adamant that she didn't want to have that done.
Well, that's fine, whatever it takes to save them.
Well, she's given me consent to sign for whatever is needed, but she didn't want to have that part done.
That's irrational. She didn't sign for this herself, did she?
No, I have the consent to sign for her to do what's best in her interest, but I have to respect her wish too.
Well, let's hope that the surgery goes okay and we don't have to make that kind of decision for her.
Well, let's hope that happens.
Guess we just have to wait and see.
Yeah.
Mr. Barry, may I please have a word with you?
Sure.
Amanda's mother, I'd like to hear this as well.
Okay, your wife's condition was a lot worse than first anticipated. She's had a lot of internal injury, and she's also lost a lot of blood. The baby's heart rate has also started to drop as a result. Your wife and child's best chance for survival right now is to have a blood transfusion performed. I understand that she was strongly against this procedure, but I strongly urge you to reconsider.
Dr. Young, she slipped into a coma and she's unresponsive.
Okay, Mr. Barry, this is a test you made very quickly. Your wife's conditioning is only worsening.
But, you know, it's really against Anna's wish to have a blood
Robert,
transfusion.
think about what you're doing. This is not just my little girl's life that we're trying to save, it's her baby as well. She needs this procedure done.
But Ruth...
No buts. Doctor, can we have a minute, please?
Yes, absolutely, but you need to make a decision very quickly.
Thank you. Robert, think about what you're doing. I know you want to respect Anna's wishes, but don't you think she would want what's best for you and the baby?
Don't you think I want to save my wife and the baby's life? But I don't want to go against Anna's wishes.
If it means that she'll get to live and have a family with you, I'm sure she'll understand. She loves you.
Ruth, it's the most difficult decision I ever have to make. If I let her go, I'll never be able to live, forgive myself. But if I sign the consent and she finds out, she'll be angry with me for the rest of her life. I'll never be able to live with that.
It's better to take a risk and save her life and give her the life that she deserves than to lose her in a decision that she's making based on religious beliefs that neither you nor I truly accept.
I know where you're coming from. I understand where you're coming from. But I want my wife to be back to normal.
Then give consent for the blood transfusion.
If I give consent for the blood transfusion, will you back me on this decision?
She may never have to know about this.
Mr. Barry,
Okay.
we need to make a decision now. Do I have your consent to do the blood transfusion?
Yes. But I don't want her to ever find out about this.
Sir, I don't think I can do that.
Okay, just go ahead with the transfusion before I change my mind, okay?
Good decision. You won't regret this.
How's my wife? Is she okay? How's the baby?
Both your wife and your child are doing fine. The extra blood was able to stabilize your wife's condition and raise your baby's heart rate back up.
Oh, thank
Oh,
God.
good.
So, she'll need to stay for a week or so for us to keep monitoring her.
When can we see her?
She's actually in her recovery room right now, and it'll take her a few hours to wake up.
Okay, thank you very much.
Thanks.
Anna, your mother and I have been so worried.
Where am I?
You're in recovery, honey. The surgery went well. You're going to be okay.
Is the baby okay?
The baby's fine, but you have to stay a couple days extra for the doctors to monitor you.
Okay, as long as the baby's okay.
Yeah, everything went well. There was just a few small complications.
Okay. Does the surgery go fine?
Everything went well. Everything went well. It's nothing for you to worry about.
See, I told you. Everything's gonna be fine. You just have to have faith.
Okay, so why don't you take a little bit more rest so that you can gather your strength, and then you and the baby can recover quickly and go home.
Okay, that sounds good. I just want to get out of here and go home.
Ruth, I cannot continue lying to Anne and tell her that the transfusion wasn't done when it was done.
Her life was saved, and that's all that matters. The fact that she was given a few drops of blood shouldn't matter. Her and your baby are going to be just fine.
But what about the doctor? She's going to have to go back and see the doctor. The doctor will tell her.
Not if we tell her not to. Go and talk to her. I'm sure she can be very reasonable. I'll go and stay with Anne meanwhile.
Okay, I'll go and talk to her. Dr. Young, may I have a word with you, please?
Yes, of course, Mr. Berry.
Dr. Young, I just want to make sure that any future conversation you have with my wife, the part about the blood transfusion is left out of any discussion you have with her.
Sir, I don't think I can do that.
But Dr. Young, I signed the form with the assumption that it's confidential between you and me. I don't want any part of this being told to her. You did your part, you saved her life, and the baby is fine. Anything you do, if you decide to tell her anything, I'm going to take any legal action I can against you.
Sir, please.
Dr. Young, her life was saved, she's stable. Her and the baby is doing well. Anything you say to her will only upset her, and this may cause her condition to worsen. I do not want you to say anything to her.
Lydia. Oh, Lydia, I'm in a terrible spot. Mr. Berry just come up to me and threatened to take legal action against me if I tell his wife we went through with the blood transfusion. In the past, I've always been so honest with my patients, but if telling her the truth is only going to hurt her more, can I truly justify the means?
I understand the problem here. This is a really tough decision that you have to make, and I don't really know what to tell you. Maybe you should take some time to think about the consequences of either telling the entire truth or omitting some of the information. You're a really good doctor, and you have a lot of experience. I know that you're going to make the right decision.
Yeah, if only I knew what the right decision was.